Much for being with us. Thank you so much for being with us tonight and across many different time zones. My name is Natasha Sood, and I'm a fourth-year medical student at Penn State, currently on my research year working at the consortium. We are very excited for our webinar today because, as you know, over the last decade, there have been increasing calls to include climate change and planetary health principles at large in undergraduate and graduate health education. And one of the strongest voices in these discussions have been health professional students themselves. And so tonight we will hear from two student-led groups, Medical Students for a Sustainable Future and the Planetary Health Report Card, on how they have addressed the inclusion of climate and planetary health principles at not only their institutions, but across the world. First, we will hear from the MS4SF team on how they identified this gap, and then from the PHRC team on how they've created a standardized metric-based system to address this. We will then take questions after the presentations from the audience. As we go along, please feel free to drop questions in the chat and we will be sure to address them after the presentations. From our MS4SF team, we have Jackie. She is a third-year MD MPH student at Tufts University, and she is the co-curriculum chair of MS4SF. She's interested in mental health, climate health, and adolescent health in primary care. Jess Mahar is a second-year medical student at Albany Medical College, and he is interested in medical education and policy. Along with Jackie, he is the co-curriculum chair of MS4SF. Marley is a post-bac student at the University of Colorado, and she works with the MS4SF curriculum team. From our PHRC team, Taylor is a second-year medical student at Indiana University School of Medicine, interested in neurology, psychiatry, and healthcare sustainability. And finally, Nuzhat is a fourth-year medical student at UCSF, applying to internal medicine and is interested in planetary health, conscious medicine, and sustainable healthcare. And with that, I will turn it over to the MS4SF team to get us started. Thank you.
Great, thanks so much, Natasha. Let me just share my screen. Okay. So today, me and Jesmer and Marley are going to talk to you about the MS4SF curriculum guide. So MS4SF is a group of medical students very interested in climate health. As of the beginning of this year, we were 400 students strong and had membership from over 100 schools. And I believe we've only grown since then. And one of the things that motivated us to start this curriculum guide, it started with Natasha and Sarah, who were last year's co-curriculum chairs. And the idea from it came from the fact that a lot of students were asking us the same questions. How do I get started? What kind of materials can I look to? Who do I approach in my school? So we thought that having a single reference that everyone could look to with a lot of these resources compiled in the same place would be very helpful. And so Jesmer now is going to tell you about exactly what is in the curriculum guide.
Thanks, Jackie. Yeah, we wanted to walk everyone through what the curriculum guide can offer because it really is an amazing resource. And so it's broken up into 6 parts. The first part being proposals for curriculum reform. And I think a lot of students, I don't know how many people have started this process or been involved with this process, but it usually starts with trying to get faculty and administrative buy-in. And that is a mountain in and of itself sometimes. But by putting together proposals that have worked in the past, the curriculum guide is able to help students get an idea of what to ask for, how to ask for it, and how to communicate those asks in a compelling way. So on this slide, I have a few titles of proposals that have been submitted, some of them by people in this very Zoom call. And they ask for different things depending on what the goals are. And we'll get into that if you can go to the next slide, Jackie. So yeah, depending on what the goals are of this climate and health implementation. So if you're aiming for something like a full clerkship, that proposal looks different, but we also have sample syllabi to kind of help guide you in that next step of the process. There are other things like a crash course syllabus. There's a few different examples of elective clerkships, and we're hoping to, as we go forward, get slides, get slide decks, and articles and other education resources that can kind of be taken a la carte to help students who are in this process design a comprehensive and change-inducing curriculum. Can you hit next slide? Thanks. The third part of the curriculum guide is the lesson materials. And these are readily available. These are things like PowerPoints, the PHRC, and things from the global consortium itself. There's a lot of good resources out there. And this is just kind of a hub where students, once they're in that process of getting the school on board and now putting pen down to paper, they can come here and use this as a good starting point. And then next slide. This is an interesting part of the curriculum guide, where it's not necessarily made for curriculum change at an institution, but it's a way to help students learn themselves about how climate and health intersect. And like the part 3 lesson materials, there's a lot of really good information out there, and a lot of it is free. So things like the IPCC Climate Change and Health Program, and I believe the Harvard Online Program and a few others are just really good resources for students to either let their institutions know about, let their classmates know about, or to use themselves while they're going through this process to be able to speak more, to be able to inform themselves more and be better advocates for change. Then, of course, there's this amazing tool, the Planetary Health Report Card, that because it's an auditing tool and a rubric to understand where your institution is at, it fits right in the process of curriculum development and implementation. So there's a link to that and contact information to the PHRC team and website, as well as a brief summary of like this amazing resource. And then the sixth part is really exciting because it's new. I mean, I guess everything is new. It's a pretty new guide, but I think it's new in general when we're talking about curriculum development in climate and health. It's a call to action. So as we start to understand how the adverse health impacts of climate change disproportionately affect Black, Indigenous, and POC communities, we also wanted the next generation of physicians to understand that relationship and begin to address it. So the curriculum guide has put out this call to action for any programs or any students or faculty or whoever to put forth resources, curricula, or any other educational materials that they have or that they've learned from regarding environmental racism. There's also an introduction to the concept and some current resources, particularly surrounding the relationship between toxic waste and race. Something that I think is really interesting is race is the #1 indicator for the placement of toxic facilities, landfills, and other waste processing centers. And it's information like that that is alarming and that we feel needs a special spur to call for. So I'm going to pass it on to Marley, and she's going to talk a little bit about how the curriculum guide has helped.
Hi, everybody. My name is Marley. I'm the curriculum guide sub-chair. So my responsibilities primarily include continuing to develop the curriculum guide and disseminating that information to different students and schools around the country. So I'm going to talk about a couple instances of how MS4SF and the curriculum team has had some great positive impact on curriculum change around the country. So the MS4SF chapter at Quinnipiac University in Connecticut has recently presented a proposal, which is an adapted version of the curriculum guide, to their dean in charge of curriculum change, with the idea to integrate discussions of climate change into 10% of their lectures. And they also have included examples and descriptions of how to include climate change into not only their preclinical curriculum, but also their clinical curriculum into their 6 core rotations. And an aspect of their proposal, which I found especially compelling, was the discussions on environmental racism and justice. And like my peers had mentioned, there's a great need to discuss the overlap between systematic racism and climate change, and how the ills and detriments of climate change are disproportionately impacting marginalized communities. And I think the Quinnipiac proposal does a great job of doing that. At Virginia Commonwealth University, they've recently integrated discussions on climate change into their lessons on infectious diseases, and how tick-borne diseases, viruses, bacteria, and fungi, diseases like this are spread and aided through warmer temperatures. And in a similar vein, George Washington University in DC has integrated an asthma module into their family medicine curriculum to talk about how exposure to air pollution in terms of ozone and particulate matter has great and severe impacts on asthma and respiratory health. So these are just a couple of many great ways that med schools have integrated climate change into their curriculums.
All right, thanks, Marley. So given this curriculum guide that we have now, and all the components that come with it, what are we envisioning for it in the future? Well, we have a couple of ideas, and I'll go through them, but we're also very open to hearing from all of you if you think anything could be helpful. So one of the things that we envision for this document is that it is always changing. There are constantly people, students, faculty, mentors, including links to slide sets, to new resources that they find, and we try to collate these and keep the document updated so that it can be as comprehensive a resource as possible. But as you've seen from what Jessmer described, the document already has a lot of sections. And for a med student who wants to introduce changes to their curriculum, seeing such a document can be very overwhelming. So one of our other goals is to make the document easier to navigate with something like a flowchart. And hopefully the way this flowchart will work is it'll ask students or faculty, where are you in the stage? Have you contacted anyone at your school? If not, maybe you should look at some examples of letters to write if you don't know where to start, and that would be the first section in the curriculum guide. And then gauging their reaction, where to go from there. Do you need more support? Do you need strength in numbers? Or do you think they're very receptive and you can go right ahead and talk about what curriculum materials that you want to introduce? Are you not at that stage yet? Do you still need to get a better sense of what exactly it is that your school teaches right now? Because a lot of students going into medical school, if you're first year or second year and you haven't gone through the entire curriculum, it's hard to say what's already being taught, especially if there are a lot of different lecturers and the curriculum is put together by a lot of different parties. The PHRC, the Planetary Health Report Card, is a really good place to start to evaluate that. And then going on further, what exactly is it that you want to do? Because there are many different ways that you can introduce change into a curriculum. And a lot of it depends on your individual institution and what you think would be most feasible. So maybe you want to add just one lecture to the curriculum. Maybe you want to add an entire course, an elective, or maybe you want to play with the existing lectures and work with lecturers to add in a couple slides to the material already being presented. So there are a lot of ways that this curriculum change can be enacted, and we hope that the curriculum guide can serve whatever need it is that the student has. And then the final part that we're thinking about is adding some patient education resources. We don't have a lot of material that pertains to the clinical years just yet. Most of our material caters towards preclinical education. So this is something we're thinking about, just including resources that students can hand out to patients, really colorful, easy to read instructions that patients can use to learn about things like tap water and the benefits of fluoride, or how to protect your child from asthma triggers. And that's it. Thank you so much for paying attention. And
Thank you so
Natasha.
much, Jackie, Jesmahar, and Marley. And now we will hand it off to the PHRC team.
Thank you, Natasha. We'll get our slides up on the board.
Yeah, there we go. Thanks.
Are you able to see them?
Yes, we can see them.
Great. So thank you all for coming to this webinar. As Natasha had mentioned previously, my name is Nushat and I am a fourth-year medical student at UCSF.
Hi, everyone. I'm Taylor, and I'm a second year at Indiana University School of Medicine.
So the Planetary Health Alliance defines planetary health as a field that's focused on characterizing the human health impacts of human-caused disruptions on Earth's natural systems. And as future healthcare professionals, we must be prepared to address these impacts of these environmental changes that have been caused by humans on our patients' health. And because climate change and environmental threats disproportionately affect marginalized populations, as mentioned in the previous talk, these issues are inherently those of equity and justice. And so the preparation for this is in the hands of the institutions that are providing our medical education. And so it's imperative that we hold our institutions accountable for educating medical students about the health impacts of climate change and other human-caused environmental changes. And so this, with this presentation, we would like to present to you the Planetary Health Report Card, which essentially serves two different purposes. It's a metric-based tool that is intended to be a needs assessment that evaluates your medical school's efforts to integrate and support planetary health in the training environment, and also to inspire institutional change so that we can advance the global planetary health movement so that we can create a healthier and more equitable world. So just to summarize in short, this allows students to evaluate and grade their institutions on various metrics related to planetary health. This is a brief history of the conception and expansion of the initiative. This is an entirely student-led initiative, and it was founded by medical students from UCSF, including Carly Hampshire, who's in who is joining us today, or in the who has joined us today, as well as myself, who is and two other students as well. This was founded in 2019. In the fall of 2018, during California's wildfire season, we were studying our pulmonary unit. And at the time, no one in San Francisco could walk around without a mask on due to the poor air quality. However, we noticed that there was no mention of the wildfires, the poor air quality, as effective of our health in our pulmonary lectures. And so this got us thinking, what other climate change and planetary health related health concepts were missing from our learning? And so the next few months, would see to us devising this list of metrics that we thought were important for medical schools to address in their education so that we can incorporate planetary health within our education. We elicited feedback from faculty and other topic experts and went through multiple revisions of this report card that we generated before running a pilot at UCSF and Stanford. In our first year, we would then collaborate with student teams from across 11 other additional schools from the US and Canada. And since then, our initiative has expanded to include 62 medical schools from around the world in our second iteration, We've also formed an international leadership team to accommodate this expansion. We look forward to expanding this initiative further and developing our leadership team further, but we will discuss this at a later slide. Here is a map that depicts the distribution of medical schools that have participated in the 2021 cycle of PHRC.
So the Planetary Health Report Card, it has 5 different sections. So the first section is Planetary Health Curriculum. So this looks at how well medical schools integrate planetary health concepts into their curriculum. You know, for many reasons, this is important. Medical students are going to be on the front lines of treating patients who are dealing with the effects of climate change. So it's important that they understand what these health effects are, how to communicate these health effects to their patients, and also that medical students understand broader concepts of planetary health, such as health system sustainability. Our second category is interdisciplinary research. So due to their resources, medical schools are well positioned to conduct research on the effects of climate change on health. This is important. It will help us to better inform patient care. Also, importantly, the public and policymakers tend to pay more attention to climate change when human health is emphasized. Community outreach and advocacy, that's another section. So not only do we believe it's important for schools to engage in planetary health curriculum research, it's also important that they directly engage with the communities most affected by these changes. So this section looks at, are schools partnering with local organizations? Are they sharing information on the environmental health effects of climate change? And are they working with local community organizations to create change? Also, we hope that they provide opportunities for medical students to be involved in these initiatives. Our fourth section is support for student-led planetary health initiatives. So because planetary health is a relatively new field, many times medical students are some of the first people at an institution to start initiatives, right? So this section looks at, are schools receptive to these initiatives? Are they providing resources for their students? Are faculty becoming involved? And sometimes, are they creating some sort of position on a decision-making body, such as a student council, where a student can present planetary health issues such as curriculum reform? Our last section is campus sustainability. So this was a new section. It was new to last year's report card. As we all know, healthcare is one of the greatest emitters of greenhouse gases. And so there's opportunity for it to make changes to reduce its environmental impact. That's why we felt that this was a really important section, and it looks at, what energy sources are medical schools using, what companies are they invested in, what sort of transportation do they use. And I want to emphasize that we focus on campus sustainability rather than hospitals, just because it tends to be easier for medical schools to have control over their campus rather than the policies of the hospitals they associate with. Next slide, please. So here we have listed some example metrics for each of these 5 sections. So for this first one, here's an example for curriculum. Does your medical school curriculum address the impacts of climate change on changing patterns of infectious disease? So something I want to know is that our scoring system in the report card, it's not all or nothing. So a school can receive a range of points depending on where they fall in this sort of continuum. So for this first metric, for example, if a school sort of talked about changing patterns of infectious diseases in an elective, they would receive a point. If they touched on it in core curriculum, they would receive more points. And then if they really went in depth in core curriculum, that would be the top score you could get. And I think having this range of points is really important because, as we know, making changes, sometimes that's a gradual process and we don't always get where we want to be right away. So this allows schools to sort of be rewarded for these changes over the years and to really keep track of their improvement over time. Next, please.
Okay, and so as points are assigned to the metrics, the students are also given an opportunity to provide a written explanation as to why that grade was provided. The points for each section are then added up, weighted, and then assigned a letter grade. And then the school will also receive an overall grade, which is an average of their section scores. On Earth Day, April 22nd, we publish a summary report with ranking tables, as you see here, as well as a summary page for each institution with their grades, their strengths and areas for improvement, along with examples that showcase the fantastic work that's being done at our participating medical schools. And we'd like to now share some of those findings with you.
So based on last year's report card, these were the areas where schools on average scored really well, and quite a few number of schools received the top marks possible. So one was that many schools have a department or an institute for interdisciplinary planetary health research. Many have hosted conferences or symposiums related to planetary health. Some or many have offered support for students enacting sustainability initiatives, which I think is really encouraging and maybe one of the most important things to do well on. Some schools have programs or initiatives to make their lab spaces more environmentally sustainable. For example, there's a school where a lab can request for experts to come in, assess the environmental impact of that lab and make recommendations on how they can improve. And then the lab can receive some sort of certification. So I think that's a really great idea. And lastly, a lot of students said that their school offers environmentally friendly transportation options. Next slide, please. And so here we have the opportunities for improvement. So one thing we always emphasize is that though we assign grades with this report card, the goal of this project isn't to assign some schools really good grades and to punish the schools that aren't scoring so well. Rather, this is a needs assessment tool, and it allows schools to see what they're doing well, what they could work on. And I think and it gives them some sort of methodical way to go about creating change. So based on last year's report card, these were the areas where schools have a lot of room to make change. In curriculum, one thing we notice is that mental health and the neuropsychological effects of climate change are rarely touched upon in curriculum. There's opportunity to talk about how climate change affects marginalized communities more. And also, schools don't really do a good job of teaching their students not only what the effects of climate change are, but how to have conversations with patients about these effects. In the area of community outreach and advocacy, there's very few communications going on between the school and its students on planetary health issues. With respect to support for student-led initiatives, very few schools have some sort of liaison, somebody serving on like a medical school council where they can advocate for planetary health changes. In the area of campus sustainability, few schools are using renewable energy and few have requirements or guidelines for their school events to make them more sustainable. Lastly, in the area of interdisciplinary research, we found that few schools offer opportunities for community members to have a say in what sort of research agenda would be helpful. And lastly, few schools are involved with the Planetary Health Alliance and or a global consortium on climate change and health. Next slide, please.
And even though we've identified all these strengths and areas for improvement, the thing that we're even more proud of than the growth of this initiative are the tangible changes that the Planetary Health Report Card has led to at many of the schools. And so, for one, there have been more constructive conversations about the topic of planetary health with school leadership. And this is an example from the previous report card, the 2020 report card, but at UCSF, at the very least, the faculty leveraged the findings of our report to get support and funding for a Center for Climate Health and Equity, which has since launched. There has been the creation of medical school report card task forces, boards, and steering groups, such as the University College of London. And across the board, we've seen new student groups that have been created, such as, for example, the Sustainable Medicine Society at Leicester University. New community partnerships have formed between community organizations and the local medical schools, such as the Sunrise Movement leaders and the Alpert Medical School of Brown University. And then in terms of curriculum, there have been permanent core curriculum changes throughout lectures at many medical schools, as well as the establishment of new electives that students can partake in. And so some next steps for the initiative, there's a lot that we can still do, as you saw evidenced by the areas for improvement that were needed. And so we would like to continue to further expand the initiative. We have on board this coming year medical schools from Germany who are being onboarded. We formed a faculty advisory board composed of clinicians from various nations who provide us with feedback and suggestions as our initiative continues to grow. We're looking to ensure that this initiative is sustainable, and this includes practices like the initiation of the faculty board, as well as operations like translating our materials into other languages for ease of access. And then lastly, we will be hosting a virtual symposium on Saturday, October 16th, to provide our student teams with an opportunity to share the very important work that they're doing. You can find more details on our website.
So as the slide says, we are recruiting for this next report card. If you think your school would be interested, or you know someone who'd be interested, please email us. Our email is going to be on the next slide, as well as a QR code to access our website. We will be having an orientation for this next Planetary Health report card on October 2nd. So we would love to see you there. Thank you so much.
Thank you very much to both teams for those incredible presentations. We will now open it up to questions. Feel free to drop your questions in the chat or unmute yourselves and ask away. Okay, I will get the ball rolling. We had a couple direct messaged questions to me. So the first question goes to the PHRC team. How is the campus sustainability metric measured?
So if you can go to our site to look at the specific report cards from last year. So there are about, I want to say off the top of my head, 11 different metrics, right? And so there's things like what sort of transportation does the school use? What sort of energy? Do they have a commitment to carbon neutrality? Those sorts of questions. And for each metric, they receive a certain number of points. So there's about 11 different ones, if that makes sense. And then at the end, we total all of those points to give you a section score.
Great, thank you. And just out of curiosity, again, for the PHRC team, have you received any direct feedback from school leadership on how they've responded to the reports? I know you touched on this a little bit in the presentation, but just curious.
Do you mean from faculty after reading it, or?
Yeah, faculty, administration.
I would say I actually am not aware of like all of the results. Most of the time it's been pretty positive. Most have been really inspired to start making changes and seeing like, oh, we're not doing this super well, so we should really work on this. I can speak from, at my own school, there were certain areas where we didn't score so well. And at first there was a lot of hesitation around that, but we just made sure to emphasize again, this isn't about saying we're bad at this. It's rather just saying this is where we can make a lot of change to really improve. And once we worded it that way and presented it that way, a lot more people were excited about it.
That's great. And were there, and no need to like name specific institutions, but were there ever any instances where an institution did not want to publish the results for any reason?
There have been a few instances where we encourage our student teams to engage with faculty at all levels of creating this report card so that they are on the faculty as well as their dean's office to ensure that they're aware that this sort of a project is going on. And there have been a few instances where at the last minute or at some point during the process that the schools had, or the team had to stop their report card creation.
I have a question for the Planetary Health report card team. Are all the report cards reported from students, or are there any faculty members that submit these grades for their schools?
All of the teams are student-led teams. Typically, they will have a faculty advisor that they're working closely with, but generally, the reports are generated by the student teams at each of the institutions.
So one thing we talk about at orientation is we really advise teams to, one thing is to try to create a team that's multi-year. So for example, I was an MS1 last year, so I didn't really know a whole lot. So we created a team with an MS1, 2, 3, 4. And we also really encourage teams to have some sort of faculty advisor who can have a look at the report before sending it and kind of giving that last stamp of approval.
We have a question in the chat. Are there any resident programs that have created curriculum or participated in the report card?
This is solely or the Planetary Health report card as it is right now is solely a medical school sort of evaluation system. There is another report card that's being developed in parallel for nursing schools, but to my knowledge, there aren't any resident programs that have gotten involved in this initiative.
I do remember in our curriculum Slack channel for MS4SF seeing some program that was working on incorporating curriculum into their residency program specifically. I forget which institution it was, but I can try to look that up.
Yeah, just to hop in on that, I remember seeing that article too, and I think the big tagline was the first residency curriculum to better prepare, or something like that. So there's not much going on right now in graduate medical education and climate and health curriculum, but it seems like there's a start.
But yes, if anyone has any ideas to be one of the pioneers for that kind of curriculum change, we would very much welcome your ideas, suggestions, questions. Maybe Jess, Marley, and I can put our emails in the chat afterwards as well.
This is a question for the MS4SF team. For the patient education resources, is there any conversation about including it, having pamphlets and things for the residents or med students to broach these topics with the patients? Would that be included as part of that resource to really assess the patient's climate risks?
That's a really interesting question. There actually is a resource that helps. It's like a structured interview that you can ask the patient at the beginning. It provides questions where you can bring up some of these topics. So I really like that idea, not only as like a passive educational material given at the end of the visit, but at the beginning, really acting like a screener and an invitation to open up some of these conversations. Again, I can't think of the specific name of the tool, but I will look into that as well.
Great, thanks. And we can include that on the website with the recording after this so others can access it.
I have a quick question. Thanks so much for these great presentations. If there's a student who is at a medical school and they don't know anybody else who's really interested in doing this, how would you suggest they get started? If they're, for example, at this webinar, they view this webinar and they want to do this, how would someone even get started approaching this topic? And that goes for anyone, yeah.
I'll start the conversation, but I'm sure Natasha, Jackie, and Marley can definitely hop in. I think the best way to start would be to find, if there exists, whatever club or whatever organization on campus is interested in sustainability or climate change or something like that. I think generally there are clubs like that. And if not, just sending out a blast and asking for any students who are interested in this sort of thing, because it really is a lot of work to apologize for the siren, but it is a lot of work to shoulder by yourself. So creating whatever community or whatever group that you can, like Jackie mentioned, it really is a strength in numbers thing, at least to start. And once you start there, then I think you start planning what exactly you want, start drafting up proposals, and then start looking at your administrator list and seeing, who are the potential people that we contact. But Natasha, Jackie, Marley, does anyone want to hop in?
I mean, I'll just echo what you said. It's really hard to do this work alone. So anyone that you can find as allies, whether it's other students, faculty members are really important, is very helpful in the long term. And sometimes what it takes is creating structure for that to happen. So if you can find out like what it takes to start up a new club at your med school, if one doesn't already exist that's focused on climate health, so that you can have access to all of these like funding mechanisms. And the PHRC and the MS4SF team are all resources that you can contact. A lot of other schools have been through the process, so it's helpful to hear from other schools what has worked. And like we mentioned before, there are a lot of different ways you can do this. So you can really tailor it to the conditions at your institution.
And I'll reiterate that sentiment a little bit. And I think figuring out a chain of command of who to contact to get the ball rolling on this can be a really helpful first step. If you don't have the numbers and students, it can be a really bureaucratic process to try and get the curriculum changed at a medical school. And so I think if you have the time and energy to figure out who the people that need to be contacted are, that is a really great and helpful first step.
And from the PHRC end of things, we agree with all of that's been said already. Definitely finding people who you can collaborate with and maybe faculty advisors to support you. You can also reach out to us to see if your institution has a team that's already in existence, or we can provide you with support in starting up this initiative at your institution.
I have a question regarding the order of which, like how change should be pursued. So the faculty, so we don't have a climate advocacy oriented group at our school right now, but I'm in the process of starting one. And then I kind of like brought up, curricular change. And then also that I'd kind of seen this report card before that kind of made a really comprehensive approach. But one question she asked me, which I wanted to ask you guys, is that she said, like, why not pursue the actual changes to the curriculum first versus doing the evaluation? Or like, and should we start working on the changes themselves and like then do an assessment after, or like do it right now so that we can see the gaps and then build on that? And I didn't really have a good answer to that, but I think I do see the value in doing an assessment, especially after reading a little bit about it. But yeah, what is your guys' advice on that?
I may be biased, but I think that doing the report card and assessment is really a wise investment of your time. You may be surprised, there may be other students at your school actually involved in initiatives. That's something I figured out by doing this report card. So it allowed me and allows other students to evaluate, like I've said, what you're doing well, what you're not doing well, and be really methodical so that when it kind of gives you support for when you actually want to make changes, right? So when you propose curriculum changes, you can say, these are what other schools are doing. This is what's best practice. And I've done the research and I know that we aren't doing it. So I think it really helps you to be more effective when you want to make change, to do that sort of evaluation at the front end.
And to add on to what Taylor just said, the other thing that the Planetary Health Report Card is great about is that as you're going through this sort of assessment process, you are not just interfacing with your fellow students and some of the faculty, you're also interfacing with individuals at various levels of your institution who are experts in their area and experts in your institution, as they may be able to provide answers to questions that you may not be able to find out by yourself. And so in doing so, you're making connections at various levels. And these are the people who are going to be supporting your work further down the line.
So we have a question in the chat. Where is the AAMC in terms of writing planetary health into accreditation standards? And I was wondering if either MS4SF or PHRC teams knew where this is at right now.
I'm not sure.
I echo.
So I'm currently scrolling through our little MS4SF Slack, because a while ago there was a lot of conversation and a lot of efforts to talk to the NBME, which is, I don't know how familiar, Michelle, you are with boards in the States, but the NBME is that overarching examination board, licensing test board thing. And there was some talk about trying to get them on board with planetary climate health questions. And I'm not sure where they left off on that, but I don't remember it going anywhere substantive yet.
I could jump in a little bit on that. This is Cecilia. I'm the director of the Global Consortium on Climate and Health. And I came to this consortium about 2 months ago and asked some very similar questions. Currently, AAMC has no standards to integrate climate and health or planetary health into medical school curricula, although there is an active group of physicians and faculty who are trying to advocate for that. We have not actually successfully gotten them into those types of accreditation standards. In terms of the USMLE, again, we're working on it. We're at a point right now where we are trying to become test writers. So when we first approached the USMLE, they said, well, we already have questions about planetary health and climate and health. We already have that. We talk about heat stress, we talk about different things, but I think, as everyone here knows, that there's a lot more intricacies that are necessary. And so really the next step is that we need to infiltrate the USMLE. We have to, become test writers. And so I'm actually in the process right now of trying to get to become a test writer for the USMLE. And I'm encouraging others to do the same, because I think, we have to do it from the inside. We haven't found a way to really come in from the outside and say, hey, this is something that we need to change. I think there could be pathways to do that. So for example, with COVID-19, there was a quick pathway to sort of get COVID-19 to be on the USMLE, but we haven't been able to find that pathway for climate and health or planetary health. So we're just going to start infiltrating from the inside. And that's where we're at. So hopefully more to come on that. The National Academy of Medicine is launching a very large, what they call a grand challenge on climate and health right now. So hopefully that will cause some movement. I know that members of the AAMC will be there at those meetings. So hopefully this is the start in the right direction. So thank you.
All right, thank you so much for that question. Are there any other questions for our panelists at this time?
Hi, I have a really quick question. So I actually founded a sort of a sustainability club / climate advocacy group at my school. And we have a course on public health that's kind of parallel with our curriculum, and I want to incorporate climate change into that. And I remember you guys said that there are lecture slides or decks that we could peruse through to get information. I just don't know where to access that because I would like to bring this up. Like I have a faculty and I want to bring this up to, you know, that course, but I'm not sure where I could find that.
Totally. So the curriculum guide has a lot of links to curricular materials. If you're looking for something more specific in terms of a specific topic for your slide set, feel free to send us an email. I'll put my email in the chat right now to see if we can find anything that's helpful for you.
Thank you, Jacqueline.
The University of Minnesota does have some slide decks related to climate and health, and that is also linked in the MS4SF curriculum guide. And so that might be a starting point for you as you broach that topic with your administrators.
And I also put a link in the chat to one of the pocket cards. It's by the Canadian Federation of Medical Students, and it has a lot of good questions if you wanted to be in a clinical setting and ask your patient some screening questions about environmental aspects that could affect their health. Stuff like transportation, nutrition, household hazards, air pollution.
Thank you so much, you guys.
Great, and we'll make sure to include all the links that have been shared on the chat on our website under the events section. You can find past events. So you'll find the recording for this as well as the links that were shared. Are there any last questions from the audience? Well, thank you very much to our panelists and for everyone for being here tonight. If you have any questions, please feel free to reach out to us. If you're a student and you would like to join MS4SF, PHRC, and the student team at GCCHE, we welcome you. Just please visit our website and you will find the Join Us tab, and we hope to work with you all soon. Thank you so much.